Ladies and gentlemen, welcome to yet another live uh, this third day of January 2024. This is Dr. Lewis, and this is the Health and Wellness Spot. We appreciate you for coming through again for yet another beautiful, informative live on diabetes. And we hope by the end of this session, we would have achieved the goals that and the objectives that all of you are here for. That we'll be able to define diabetes. We'll also be able to know the types of diabetes. We will be able to also know the complications of diabetes. And then uh, we will know now the dietary modifications and even the lifestyle modifications that you need to do if at all you are diabetic so that you can reverse diabetes. So this will be an interesting one. So tag that person, that diabetic client, tag that brother, that cousin who is actually diabetic so that we can help them learn and relearn. So meanwhile, as you join in, allow me to set up my YouTube studios again. Good, good. I think we are set to go. So if you have any questions concerning this topic, uh, be kind to ask them in the comment section. We will pick them up and respond to them adequately, okay, at the end of it or even uh, in between the live. So thank you so much for coming in. Thank you so much for joining in. We appreciate you. Before we start, as usual, it's always courteous to welcome people aboard. So I see Arinetwe Andrew from Uganda who's saying he's listening to us. Welcome aboard, Arinetwe. If you're new here, kindly consider subscribing. And thank you so much for passing by. You'll be sure that you will learn something new today. If you are a returning subscriber, thank you so much for being of importance to us. Thank you so much for trusting us with the information that we share. So we welcome you aboard. Lydia Nyamisa, Priska Anyango, and then Augustine Odindo. Always a pleasure having you around. So without much ado, let me just get straight into it. Now, all of you have heard of diabetes. Most of you have relatives, friends who are diabetic. And there's a lot of confusing information about diabetes in general. Most of these people are on medications for diabetes. And this is because the doctor said once you have diabetes, it is irreversible. And you will be taking those drugs faithfully for a lifetime. Now, I hate to break to you this, but the reality is diabetes is reversible. Underline that word reversible, and it's in capital letters. You can easily and comfortably reverse diabetes. And that's a misconception that most healthcare practitioners have propagated to impart fear in you. Once they sell you the fear, and now once you buy the fear, it will be easier for them to just refill your prescription as they milk your pocket from day one of therapy until the day that you end up in that grave. Now, before I even define diabetes, allow me to just take you through the complications that come as a result of this condition that is called diabetes. Now, diabetes is basically sugar in the system. So these are the complications of sugar in the system, and most of you have at some point experienced such uh, as you lead your daily life. You've seen somebody with stroke and you don't even know what stroke is, but you've been told that this guy is suffering from stroke. That is a complication of diabetes. You've had a dental problem, so your teeth are messed up and you're always visiting a dentist. You have had several extractions, but it doesn't get better. That is a symptom of diabetes. Okay, you've lost your sight, or you always see blood vision, and you're wondering where is this coming from. That is a symptom of blood sugar, higher blood sugars and higher body sugars, and that is also a complication of diabetes. Now you've had recurrent yeast infection for the women. You're not on any contraceptive, you're not that obese, but you keep on getting this recurrent yeast infection, you keep on getting sick also, general sickness, because diabetes lowers your immunity. So therefore, that low immunity is another complication of diabetes. Now, heart disease is a complication of diabetes. Kidney failure, and all of you know that if you have a failing kidney, you will have multiple complications. For example, kidneys control blood levels and blood cells production by the bone marrow through a hormone that is called erythropoietin. So if your kidneys are failing, you don't have enough erythropoietin. Therefore, your bone marrow gets it difficult to synthesize red blood cells and even the immune cells, the white blood cells. So you have problems with anemia. You will also have a problem with vitamin D, which will lead you to low immunity because vitamin D plays a very major role in immunity and bone development. So that means you also have osteomalacia and weak and brittle bones, even rickets in children. Now, this vitamin D is activated. The last step of activation of vitamin D happens in the kidneys. Therefore, if you don't have functional kidneys, what do you expect? Low vitamin D or vitamin D deficiency. Now, others, other complications will include erectile dysfunction for men. So you realize most men who are diabetic have or struggle with an erection. Okay, so it's very difficult for you to erect when you're having diabetes. Some will lose a lot memory, and actually, memory loss or Alzheimer's and dementia are actually classified as type 3 diabetes. So we'll talk about that also. Okay, so those are just basically some symptoms. And again, the numbness, the peripheral neuropathy, the amputation, all these are complications of high blood sugars and high body sugars, which is basically known as diabetes. So the system defines diabetes as chronic or elevated blood sugar levels. Now, the drugs for management of diabetes, their mode of action is actually to lower blood sugar levels. When we go to therapy, we will get to understand why I keep on questioning the therapy for diabetes. Because if they are lowering blood sugar levels, where is this sugar going to if somebody is diabetic? So we'll get to that. However, my definition for diabetes is simple, that if you have a lot of sugar in your system, not necessarily your blood, but your body cells, the storage forms of glucose, that is the fat cells, that is the liver cells, and that is the muscle cells. So you have enough of it there. And then now, too much of it is being spilled back into the bloodstream because there is no more storage. Now your blood levels of glucose will start to elevate and it will be chronic. So that will mean you are now confirmed diabetic. But if you realized the tests for diabetes, most of the tests for diabetes actually focus on the amount of sugars in the blood and not in the cells. That is a problem because that is where therapy starts to get a mess. Because these tests are focusing on high blood sugars. And we all know if you consume a carbohydrate rich diet, an hour down the line, like for example, if you eat a cake, an hour down the line, if you take a blood sugar, it will be high. If your child keeps on consuming yogurts, sweets, and cakes, their blood sugars will always be high because they are carbohydrate dependent more than fat adapted. So once that happens, the body does not know how to burn fat to give you healthy energy. The body only understands how to burn carbohydrates. So your insulin levels are always elevated. And why are they elevated? It's because anytime you eat that carbohydrate, that pizza, that chapati, that ugali, that rice, anytime you consume these carbohydrates, what happens is they will be broken down to the least or the minimal form of carbohydrate, which is the monosaccharide. This is the galactose, this is the glucose, and this is the fructose. This is what will be absorbed into your bloodstream. Now remember, in your blood there is a normal or a normal range of blood sugars, the blood glucose. That normal range is maintained by two hormones. One hormone is glucagon, which is basically a hormone that is high in the fasted state. So when you're fasting, you go into low blood sugars because you've utilized that glucose. And then the liver will produce that hormone, the pancreas, sorry, will produce that hormone that is called glucagon. And this hormone will instruct the liver to break down all other macronutrients, the fat and the protein, to give you glucose. That is what we call gluconeogenesis. So you synthesize glucose from non-carbohydrate sources. So glucagon increases your blood sugar. So it takes back these blood sugars back to the normal range. If you have high blood sugars, so you've eaten so much carbohydrates and sugars, what happens is the level of glucose in blood goes beyond the normal range. And then the pancreas produces insulin. And the work of this insulin is to actually send this glucose that is rising into the cells for utilization. So insulin opens up the gate. It's like a key, opens up the gate so that these cells, the muscle cells, the fat cells, and the liver cells open up. Once they open up, glucose flows from the blood into these cells, either for utilization in muscle cells, for temporary storage in liver cells, or for prolonged storage in the fat cells. Once that has happened, this now closes back, insulin is depleted, and the body goes back into homeostasis. Now, the body is as sharp or as clever as your great grandmother, that when you have more than enough, you will have to store it for future. So if in case in future you will lack, you will now get your food from the stores and start utilizing it. That's the only reason why the body stores glucose in the fat cells in form of fat. Because remember, fat cells, when you break down fat, you get ketone bodies, and these are higher molecules of energy than glucose. So actually, the body is preparing for disaster. It's also preparing for you to fast one day. There will be a disaster, natural disaster, so you'll not eat for days. And therefore, the body will now turn to these fat cells to burn them by increasing glucagon. So glucagon is the fat burning hormone, but insulin is the fat storing hormone. So if your insulin is always high, you will keep on storing glucose in these cells. You will keep on storing until you reach a point where these cells, the fat cells and the liver cells, are so full they cannot take in any more glucose, even though you continue eating that glucose, that carbohydrate, and even if though you continue producing that insulin. So it continues training the pancreas to produce insulin, but this insulin is not enough. So the body still thinks you're starving because the glucose that is rising in blood and the insulin that is rising in blood actually tells the body that you're starving because there's no glucose in the cells. There's high glucose going up in the blood, but this glucose is not able to go into the cells because they are filled anyway and they cannot be utilized. So the body thinks you're starving. Now the body turns to fat to break it down so that it helps you from the starvation situation. Now remember, it's a false starvation because you're just unable to pump this glucose into these filled cells and into the muscle cells that are supposed to, they need it for energy. So your fat cells are full, your liver cells are full, but your fat cells cannot take in glucose because there is no insulin. They are not sensitive to this insulin. That is the time when you start understanding that when you go to the lab and take a blood sugar test, whether a random blood sugar test or a fasted blood sugar test, it will be high because of it is still elevated in the blood, even though your insulin levels are going up. Okay, that's what you call insulin resistance. Now, that level of insulin resistance, that is the mother of the metabolic syndrome. Anytime you hear the word syndrome, just understand it is a combination of multiple diseases or conditions. Metabolic syndrome, high fats in the system, diabetes, which is high sugar in the system, heart problems, kidney problems, and now you're told that you need a drug for exactly what diet causes. That's the reason why I start questioning these drugs. Anyway, that's something for a later review. So this is the point. So diabetes is not necessarily high blood sugars. It is high blood or high glucose in these storage cells, the fat cells and the liver cells. The one that is just high in blood is a symptom of diabetes. Now, the drugs for diabetes focus on treating these symptoms rather than treating the cause. They don't clear the glucose in the cells. They only clear the glucose in blood. But I just told you When you eat carbohydrates and the blood glucose are raising up, insulin comes in to pump this blood glucose into the storage cells, which are the fat cells and the liver cells. But a diabetic person is somebody who has been consuming carbohydrates on a chronic level, like on a daily basis. So if insulin is coming in, if you're taking a diabetic drug, if you're taking insulin short, where is this insulin going to pump this glucose to when the storage is full? Like if you have a refrigerator at home and then it's full of food or with food, and then you still go to the markets or the supermarket and buy more food and then bring it there, would you fit it in that refrigerator? It cannot fit in that refrigerator. So you'll end up either you start emptying the refrigerator, use the food that has been stored there, and then now you can store new food. But that's not what is happening with diabetic therapy. Diabetic therapy is actually focusing on this new food that you're coming with, but ignoring. So it's actually telling you, go ahead and cook this new food, but let the one that is in the fridge remain there. So when will you ever burn? When will you ever empty your refrigerator? Our essence in life is to lower insulin to a lower level so that you raise glucagon, so that you start burning this glucose that is stored in the fat cells, that is stored in the liver cells as glycogen, so that you start producing either glucose or ketone bodies that will supply your system with energy. But most of you eat carbohydrates from morning to evening, actually morning to morning. Because in the morning you're taking tea that has milk and sugar. Milk has lactose, which is a carbohydrate. Sugar is a carbohydrate, a simple carbohydrate. And then you add on bread that has been smeared with margarine. So margarine is a seed oil, and bread is a simple carbohydrate and a wheat product for that matter. And then you add on a fruit in the morning or a juice. Then you add on the processed red meats, the sausages, the smokies, the ones that the system will never warn you against, but it will warn you against fresh red meat from the butchery. That is your breakfast. At 10, you're in the office, you're taking another tea plus sugar, and then plus chapati or mandazi in the office. But you drove to work again. And then now at 1, even before 1, at 11, you're busy yawning in the office because your body has already burned this glucose and now sending you into yawning because your blood levels of glucose are going down because of high insulin. So it sends you into cravings. You start yawning. Walk into an office, a government office at 11, everybody's yawning, everybody's angry. They don't want to even work because their mind is so attached to sugar and they just want a simple boost in sugar. That's why they tell you, my glucose is low, so I need soda. My glucose is low, so I need tea. Tea makes me get activated. It's not tea, it's your addiction to sugar. So at 1, you're taking your rice and beans or your chapati and beans. All is carbohydrates. Beans are complex carbohydrates. Chapati is a simple carbohydrate. Rice is a simple carbohydrate. Beans are complex carbohydrates. You add on a vegetable, which is fiber. Fiber is also carbohydrate. Then that is cooked in seed oils. So unhealthy foods. So at lunch hour, you have taken also 90% of your plate is carbohydrate. At 4, you're taking another tea or juice or coffee that has 6 tablespoons of sugar. And then you will drive home very angry at the jam because you're wondering, when will I get home to just have a bowl of my ugali and my vegetables and my 2 pieces of meat? Again, 95% carbohydrate. And then now you snack on your favorite snack as you head to bed. Another carbohydrate, biscuits, popcorns. Then the cycle continues. So your insulin levels are always high. And by the way, anytime you snack, you think you've not eaten, the body recognizes snacking as eating. So the cycle continues. And as you do that, chronically, you get addicted to carbohydrates because sugar, the body loves sugar. But the body does not appreciate sugar because sugar is the worst energy source. Glucose is the worst energy source for your cells. And that's why it has to be regulated. So the higher it goes, the worse it becomes. But most of you are addicts to carbohydrates because the body knows glucose is a quick fix. It is not easy for you to burn fat to get ketone bodies. It's not easy. You need to fast. You need to work out hard. You need to eat healthy keto. It's not interesting. It is not easy, but it's the best way. So the body appreciates glucose because it's a quick fix. Also, once you eat sugar, the body produces dopamine, a hormone that gets you into addiction. This is a feel-good hormone. So you feel good about it and you keep on eating sugar. That's why you will even cut somebody's throat when they warn you against sugar. So the body understands this. And the body knows it will be so hard for me to burn the fat to get the energy. But the body knows it doesn't have to do anything to burn sugar. It's just the simplest way possible. So it gives the brain a quick fix, and the body likes that. The body does not like to consume a lot of energy when it's trying to break down to get energy. So it wants to preserve energy. So it rather preserve the fat and burn the glucose, which is the easiest way. So you chronically consume carbohydrates, and then your insulin levels are always high. So you keep on pumping this sugar into the fat cells, convert it into fat, because sugar has three fats. Fat number one is this sugar has to be converted to ATP in the muscle cells, so that you get that ATP is the energy currency. That's what you call energy. I want energy. That is in the muscle cells. How about you're inactive? You keep on driving. You don't even take a walk. You're sedentary. That is where the glucose does not do anything. Number two, fat is sugar is converted into glycogen and stored in the liver cells temporarily, so that in any case your blood sugars go down, the liver will burn this glycogen to give you glucose to bring that sugar back to normal. And number three, excess of the carbohydrate that you're eating, the glucose that you're consuming, will be converted into fat and then stored in fat cells as fat. And this is the reason why you start growing fat. So stop blaming protein for your fatness. The carbohydrates are the ones that are responsible. Stop blaming animal fats. If I tell you to eat fatty meat, you're always complaining, I'll grow fat. I tell you to eat eggs, 8 eggs every day. You tell me, I'll grow fat. But you are fat without eating the eggs. Are you not thinking? You've grown fat by just eating rice and beans, rice and beans, rice and beans. Now you're fat. And somebody's telling you, for you to unfat, eat eggs. And then you start complaining. Why would I, if I eat eggs, I will grow fat. You're fat already. You have nothing to lose, though. So it's time for you to start listening deeper. Once you start listening deeper, you'll see these things. So carbohydrates are the ones that are making you fat. We like blaming protein because protein does not give you the dopamine hit. Fats do not give you the dopamine hit. They don't give you the excitement that you'll get. You cannot, if you eat 4 boiled eggs, the excitement will not be the same as somebody who has eaten 6 chapati. Chapatis are very, very, very sweet. They stimulate the receptors for morphine. They mask the taste buds, and then they give you dopamine hits, and then they raise your insulin. So it's just the body working against you. Okay. So for the type 1 diabetics, definitely you're born without functional beta cells, but if you're a child, it's easier for you to survive because your cells are rapidly multiplying. So it's easier for you to survive. Since you just go on a zero carb diet, and then exercise, and then healthy keto, you rejuvenate, and the pancreas will start rejuvenating, and the cells will come back, and you'll get your insulin back. But again, reduce the amount of insulin that you're taking. Talk to your doctor to reduce that dosage of insulin. Why? Because the more you take an external shot of insulin, the more you tell your pancreas not to work. The more you kill the pancreas. For the type 2 diabetics, it is 100% reversible. We'll talk about reversing it. Now, the type 3 diabetes is the one that I told you, the memory loss, the Alzheimer's, and the dementia. That is what we classify nowadays as type 3 diabetes. So anytime you lose memory, just understand that that's high sugar in your system, because sugar hurts brain cells, sugar hurts your nerve cells. And I'll talk about that again when I talk about the complications of diabetes in details. So when you're trying to use that regimen for drugs that actually are supposed to treat diabetes, the intention of those drugs is not to treat diabetes, is to treat the symptoms of diabetes as diabetes establishes itself. That's the reason why those people who still go for dialysis, those people who still get their legs chopped off, those people who will still go blind, those who will have uncontrolled blood pressures because of kidney failure, anemia, chronic conditions, and infections, low immunity. These are the same people who are on higher doses of these drugs, the metformins, the glibenclamides, the Noglux, the insulin therapy. There are high doses of these medications, but these people still go back and get an amputation. So why am I being amputated for a condition that came as a result of diabetes when I'm actually treating diabetes? It just tells me I am treating the symptoms of diabetes and I'm not focusing on anything else. That's when you start questioning that, and then you'll be flagged, of course. Because again, there's just a war between the right and the wrong is always above the big pharma. I'm not questioning the drugs for diabetes. I'm questioning the treatment of diabetes. If somebody is having high sugar levels and then you want to lower that high sugar levels, where is this high sugar levels coming from? Why don't we stop where this is coming from instead of giving them a drug to take this drug to just mask the symptoms as you continue eating what you've been eating? Diabetes is a dietary condition, and dietary conditions can never be managed by drugs. You can only manage dietary conditions by dietary modifications, period. So for example, if you have insulin resistance, so it means your cells are so full, they cannot take in glucose anymore. So even if you open that gate, there's no glucose that actually more glucose will flow from these cells back to blood than flow from blood into the cells. But the reality is that is what we are doing by giving you an insulin shot in the morning and evening. We are trying to tell you continue eating that bad food. Then we'll give you an insulin shot. So that bad food, those carbohydrates that you're consuming every day, don't stop. Keep eating them so that you raise your blood sugars. And once you raise your blood sugars, because your fat cells are very full, now your blood sugars will just keep on raising. And as they raise, we'll give you an insulin shot. Don't worry, we'll give you a high dose of insulin shot. This insulin shot is supposed to send this glucose into these cells that are already full. So now where are you taking this glucose to? This is the reason why when they start rupturing, you start getting the peripheral neuropathy, the numbness. When they rupture, the optic nerve ruptures, the retina ruptures, you start getting the blindness. When they rupture, the nephrons in the kidney start to rupture, and now you start having all these complications of the kidneys. So that is what we call nephropathy. So these are the minor complications of diabetes. One is the retinopathy, the eye rot. Two is the nephropathy, the kidney rot. And three is the peripheral neuropathy, the nerve rot. Now, this is the reason why you start feeling burning sensations. And even if you get pierced, you don't feel the pain. It's just sometimes you feel so cold in the feet, sometimes you feel so hot in the feet, but you don't understand where this is coming from. This is sugar killing your nerves. Let me explain that. Now, on the kidneys, sugar actually clogs the blood vessels that supply the kidneys, the renal arteries, because sugar causes endothelial damage. Endothelial is the just lining that lines the blood vessels. So once it causes damage of that, and then it creates a rough surface on the blood vessels. So they start attracting these blood cells. Once they attract these blood cells, they start to grow thick and hard. That is what we call atherosclerosis for those who are having problems with the heart and even the stroke. So atherosclerosis will actually limit blood flow towards the kidneys. And remember, the kidneys' function is to filter blood. So it needs perfusion. Blood has to flow into the kidneys for filtration to occur, to increase the pressure that is going into the kidneys. But sugar attaches to red blood cells in a process called glycation and then clogs the arteries that are supplying the kidneys. Therefore, blood flow towards the kidneys is limited. Once blood flow towards the kidneys is limited, guess what will happen? There is no supply of nutrients towards the kidneys. There is limited blood flow towards the kidneys. There is no supply of blood, the army, the white blood cells towards the kidneys to help it repair when there's an infection. So guess what? Urinary tract infections are starting to come in because the kidneys don't have the immune cells. Guess what? The kidneys starts to get into ischemia. So the part of the kidney starts to die. When it starts to die, now you start having problems with vitamin D, problems with anemia, problems with uncontrolled blood pressure because the kidneys control blood pressure. They maintain blood pressure and also salt balance. Sugar also blocks the supply of nutrients towards nerves and then kills the nerves. So even in your extremities, you will not feel the pain. You will not feel the sensation. You now start feeling tingling. That's like piercings. Start feeling hot or cold feet. And guess what? Where that is headed to? You are now killing the nerves that supply the legs, so your toes start to fold, and then you have such like toes. Then your leg, your bones start to become very brittle. You have deformed bones, the Charcot's arthropathy. It's called Charcot's arthropathy. Now you don't have nerve supply towards the leg, and then you don't have blood supply towards the leg. What will happen when you prick these legs? You don't feel any pain. So any slight wound, you will not feel it. When you don't feel it, and then that means you start getting into problems. So you're headed for amputation. And realize most people who come for amputation or who go for amputation, they get to the hospital very late because that wound that they got, that pricking, that possibly that wound that they acquired from a prick or from hitting their toe or from even a rub from the shoes, they don't feel it. So by the time they're going to hospital, that wound is massive because sugar also, the high sugar in the system is actually a culture for bacterial growth. So that wound opens up. It doesn't heal because there's no immune cells going towards the leg, there's no nutrients going towards the leg, and there's no nerve supply towards the leg. So that leg starts to rot so fast, develop gangrene because of microorganism and inversion of microorganisms. And these microorganisms have food already in that wound in form of sugar. So they feed on it and cause you problems. And nowadays, even hospitals are treating those wounds, the diabetic wounds, they are treating it with honey. So you're treating sugar problems with sugar. Shall we ever survive? Sugar problems being treated with sugar. Now also, nervous supply towards the brain is altered by sugar, so you start losing memory. You block blood vessels that supply the heart, so you get that heart failure or that cardiac arrest or heart attack. You block the blood vessels that supply the extremities, the liver. You're just hurting the entire system completely. And this is where the problem is coming in. So for bladder infections, is because there's no immune supply towards the bladder. For brain problems, nerve hurting. For eye problems, the optic nerve is hurt, the retina is hurt. For the amputation is because there's no nervous transmission to the legs and there's no blood transmission or blood flow towards the circulation is inhibited. Circulation towards the foot, towards the extremities is inhibited. So you start getting all these complications. For those people who are suffering erectile dysfunction, man, diabetes will kill your manhood because one, it lowers your testosterone. Number two, it kills the nerves that supply the penis. And number three, it reduces the blood flow towards the penis. And remember, erection is as a result of blood flow towards the penis. So once the penis gorges with blood, it gets an erection. So you don't have nervous supply towards the penis, and therefore the brain to the penis supply is cut off. Now you don't have blood flow towards the penis, so there's no gorging of blood. And now the flag is always down. But guess what you'll do? You'll go to the pharmacy and buy Viagra. You'll not go fix your diet. You run to the pharmacy to buy those sildenafil tablets to help you get an erection. That is a temporary situation. You're actually fixing the quick fix. You're going for the quick fix. But you're forgetting that this is just a sign that you're in trouble. The major sign is developing under the water. You're actually developing a serious problem below the waters. What you're seeing is superficial. That's just a symptom. So it's telling you there's danger coming. You're already hurting your kidneys. So you're going to get into hypertension. So all these complications of blood sugars are a mess. They're a mess. And when you talk about it, I've seen even your online influencers telling you that sugar is healthy and therefore because your DNA is made up of sugar. Now that is somebody who doesn't even understand what they're saying. That is a crook. It's high time you run away from crooks. Ribose and glucose are not the same. They don't even come from the same sources. That is one. Number two, if at all sugar is not a problem, why are we having all these rising cases of diabetes, hypertension, cancer, kidney failure, heart attacks, and nobody's saying anything? Why do we have a lot of money being pumped into research for diabetes, yet there is no change? The curve keeps on flying high. Why do we have all these diet soda in the market? We have these brown breads and brown chapatis in the market. We have these diabetic diets. We have even keto chocolate bars. Why do we have all that? But the cases of diabetes are still on the rise. People are still growing fat. It's because we are ignorant, and the people who have made us ignorant are those who are supplying healthcare to us. These are the doctors. These are the nutritionists who keep on singing about fruits being healthy. These are the rogue doctors who keep on dishing an insulin therapy to you. Believe me, insulin therapy was designed actually to be for emergency cases. And anytime I tell people to fast, diabetic patients to fast and lower that dose of insulin, lower that some of the drugs that are just useless in the prescription, do away with them. When you tell the diabetic patient that way, they are thinking, if I drop these drugs, I will die. But you will still die using those drugs. So they tell you, if I fast, I'll faint. My doctor said I cannot fast because diabetes patients are not supposed to fast. And then your doctor defends that lie by telling you that if you fast, you'll get into DKA, diabetic ketoacidosis. That is a rogue doctor. Doctors who don't understand there is a difference between ketosis and diabetic ketoacidosis. So let me explain that to you. Diabetic ketoacidosis, from the word diabetic, it has to be in a diabetic patient. So you will rarely, near 0.2% of people who have ketoacidosis are not diabetic. 98% of these people who have ketoacidosis are diabetic. So what is DKA? Now, there is a state that you're supposed to utilize glucose, that the carbohydrates that you're eating are turned to glucose and you're supposed to utilize that glucose. However, if you're type 1 diabetic, you don't produce enough insulin. If you're type 2 diabetic, chronic type 2 diabetic, you have your cells, the storage forms of glucose being full, so you cannot store glucose in these cells. So what is happening? What is happening is you actually having a rising amount of glucose in your blood, super high glucose in your blood, because you're not able to send them into these cells for storage or for utilization. Now remember, when insulin is low, glucagon is high, and glucagon is the one that instructs your cells to burn fat to give you ketone bodies. So now you're diabetic, your blood glucose is going super high, and then your body thinks you're still starving because this blood glucose is not going into those cells. So what it does is it turns to the fat cells, start burning them to produce ketone bodies, and these ketone bodies are highly acidic. So they lower the pH of blood. They cause your blood to become acidic. So now you have very high levels of glucose in the system, and also you have very high ketone bodies in the system. So these two are actually the ones that are causing you DKA. So if you hear a doctor telling you if you fast, you'll get into DKA, that is a rogue doctor. When you're fasting, you're going into ketosis, not DKA. It is called ketosis or ketogenesis. What is that? This is an alternative source of energy to the system when glucose is low. Now, when your system is functioning, when you burn that glucose in blood and the level goes so low, your insulin is so low, now the body produces glucagon in high amounts. Therefore, you turn from glucose into the fat cells to break them down to give you ketone bodies. Ketone bodies are the best energy sources for your brain. They heal inflammation in the system. They are so good in detoxifying the system in general, and the body appreciates them. The only difference is, for you to get ketone bodies for energy, you have to burn the fat cells, which is the hardest thing to do. You will have to spend energy to burn that fat cell to give you ketone bodies. So the body prefers glucose because it's a quick fix. So the body will send you into cravings so fast so that you can eat that carbohydrate, so it stops burning the fat because they also want to spend energy. Good things don't come easy. They don't come easy. Now, when you start fasting, you will experience a lot of issues. You'll experience that fever. You'll experience that shaking, that shivering. You will have the joint pains. You'll have nausea and vomiting beyond 48 hours of fasting. Or if you're attempting a fast, a prolonged fast in the first time, you'll get all these weird symptoms: muscle weaknesses, confusion, dehydration, vomiting and nausea, headaches, migraines, and you want to give up. Don't give up. When you're fasting and you get to realize those symptoms, never give up. Why? Because there's something called a ketotic flu. Ketotic flu means you're transitioning from being a carbohydrate dependent person to a fat adapted person. That is the best state. So that transitional level is the one that actually gives you those symptoms, because the body is trying to fight it. It's a new thing. So the body is used to burning glucose to get energy. Now you're introducing a new thing. So the body is not excited at all. So it has to fight back. Through that fighting back, you get all the symptoms. And now you give up. When you give up, you go back to being the same person, the carbohydrate dependent person. So keep pushing when you get to those levels. This means your insulin levels are very low. This means you're turning into fat burning and you're getting the healthiest energy sources. So, diabetic patients will start fasting. What takes you into hypoglycemia is not fasting, is the side effects of insulin therapy, is the side effects of oral hypoglycemic agents. For example, glibenclamide, famously known as Nogluc. Most of you know that. That is a drug that has a side effect of low blood sugar levels. So that is a drug that will actually make you worse when you're fasting. So you'd rather talk to your doctor to reduce the dose or do away with it and start eating healthy keto. Once you just started eating healthy keto, fasting, slow by intermittent fasting, and then as you head to prolonged fasts, then you can now do away with those drugs. It's that simple. It's a transition phase from bad diets to good diets into fasting slow by slow and now dropping the drugs as you adopt healthy eating. You don't need carbohydrates in your diets at all. They are not necessary. They do not have any deficiency condition. So don't eat to be full. Eat to have. Don't even talk about the balanced diet. It's a fallacy. Enjoy nutrient-dense foods. These are the protein, animal protein for that matter. Drop the plant protein. Animal protein, vegetables, the cruciferous vegetables, the saturated fats, the healthy fats, the ghee, the tallow, the butter, the coconut oil. Go into fasting. Go to the gym and burn extra of it. Just create a calorie deficit state. Burn that fat to the gym. Go and lift heavy. Don't go and run on a treadmill for 30 minutes. Go and lift weights. Have healthy sleep. Enjoy the sun. These are natural therapies for diabetics. If you're diabetic, please try and go on a zero carbohydrate diet for about 3 weeks and see what happens to you. Go on a zero sugar diet, no fruits, no sugar in all forms, no processed foods, no carbohydrates, ugali, chapati, rice, nada, nothing of the sort. Just go on protein, animal protein, healthy fats, and vegetables and see the transition that will happen to you in only 3 weeks. Try it. You've been taking those drugs for the longest period of time. Do you think it's still healthy for you? Just try once and you have nothing to lose. So try it and see what happens to you. Good. So meanwhile, let me go to the questions and try and answer that before I talk about the diabetic foot and the complications, other complications for diabetes, and the management. Those will be the end result of this. Good. Well, I hope you're learning something. If you're not, you can easily ask so that I can clarify before we finish this. Because we've been singing about diabetes all through, and it always seems like it's the hardest thing to talk about, and people are so sensitive. Somebody somewhere is always defensive because their father is diabetic, so therefore they've been told it's irreversible. So if you get into these problems, it's a serious issue. If you tell them to drop these drugs, they are looking at you as though they will die the next minute. Even though they're not getting better, they don't want to consider any alternative sources of therapy because the doctor who is so deep into guidelines has told them that this is what you have to do. And if your blood sugars keep going up, the only thing that we can do is keep on increasing the drugs, keep on increasing more drugs on your prescription, keep on increasing the doses. You're on metformin, 1 gram in the morning, 1 gram in the evening. You're also on glibenclamide in the evening. And you're not improving higher doses, you're not improving. They just change your drugs because that's what they have been designed and conditioned to think. That if it's not improving, take him on this other class of diabetic. But these drugs, you realize, they work through the same mechanisms. It's a waste of your precious time. There are drugs like sitagliptin, and I know most of you are now being shifted to that side. It's a drug that is combined. Sitagliptin is one of the drugs that is combined in another formulation that starts with the word T. I'll not mention it. Starts with T and ends with the word met. So those people who are using that drug, it has acetagliptin. The gliptins, any diabetic drug that ends with that gliptin, those are drugs that are very dangerous to you. Because one of their side effects is to kill the pancreas. They actually cause pancreatic cancer. So you can imagine the pancreas is the one that is supposed to actually maintain your blood sugar levels, help you to regulate blood sugars. Now you have a drug for diabetes that kills the pancreas. What does that tell you? they are actually creating a market in you, a customer, a client for a lifetime, because the next dose that is coming in has to be insulin. Because since you've killed the pancreas, you cannot produce insulin, you cannot produce glucagon. So since you cannot produce glucagon, you cannot burn fat. Since you cannot produce insulin, diabetes keeps on going up. And therefore, the next thing we'll do is, instead of you just activating the pancreas, we'll give you an external shot of insulin, because you already killed whatever produces insulin. So now you're going into deficiency of insulin because we've killed your pancreas using the side effects of the drug that was trying to help you treat diabetes. Then what? Insulin therapy is coming in. And once insulin is coming in, you keep on pumping glucose into these cells that are already full. So they come to a point they rupture. So guess what is coming next? Dialysis. You've ruptured your kidneys. What is happening now? Dialysis. So we have dialysis here, and it's 10,000 per session, 3 sessions in a week. That is 30,000. How many of you are working so hard to earn money that will be used for your dialysis because of ignorance? When you're in that bed waiting for that dialysis to happen, you will never say mbinguni tutapewa mwili mpya. You will never say we will all die anyway. Your family will be busy disturbing other people, trying to open WhatsApp groups to get money to fund your dialysis sessions. But you ate the sugar alone. You did not bother about other people. So it's high time that you start concentrating, start listening, stop being ignorant. Anybody who is trying to spread health information, listen keenly. And the best thing about health and nutrition is that once you try it, your body will tell you you're doing the wrong thing. Like you eat chapati in the morning or bread and you're busy yawning at 9. That is the body telling you, hey, you've been feeding me with 0 calories, basically empty calories, not 0 calories. So much calories with empty, no nutritional value. You go eat your ugali because ugali will give me energy. And then the next hour you're sleeping in that office, 0 productivity. So how did ugali add your energy? Come on, we can do better. We can do better. Virginia Karanja, I see you. I see Catherine Washira, Samuel Kiragu, Paul Biriomuriwe. I remember you, Paul, from yesterday's live. Amazing, amazing. Thanks for coming back on the show. I am from Uganda. I remember you, sir. Halima Hussein. Always a pleasure having you around. Dennis Bolanos. Dennis, how are you? How is the West? Julie, we welcome you aboard. Dr. Kombucha. Hello. Evelyn Akola, Cecilia, Anderson Ganya, Ma'ahl. I don't know if that's Ma'ahl or Ma'ahle. Please, doc, help my mom. She's 80 years and diabetic. She's been in medication for more than 20 years. And last year, she was diagnosed with cyst. What is the cause of that? You cannot ask the cause of a cyst when the blood sugars are so high. Definitely, estrogen levels are so high because she's past menopause and she's high in sugars in the system. Therefore, that is the answer. Safi, how are you? Annie Mwangi, I tried fasting. Let me tell you, nilitetemeka. I felt weak. I just ate. Now you see, you gave in to your body's demands. At that moment when you feel so weak, it is not weakness. It's your mind playing games on you. Because remember, you've been eating so bad foods. There's so much carbohydrates and they are filled in your fat cells. So you need to burn that fat to give you ketone bodies and glucose. You can still burn. Eating food, energy will not come from the food that you just ate. You lied to yourself. And if you ask me, those people who have attempted a 48-hour fast and failed, possibly at 24 or beyond, they failed, they'll always regret it because they always feel like they did not eat enough. Because when you're breaking a fast, you'll not eat as much as you thought. I am so hungry, I want to eat so much food. You'll not eat that much food. So when you break your fast when others are still fasting, you feel so much guilt because others are going on and pushing on, but you've eaten, but yet what you ate is just a minimal amount of food because the body had adapted not eating at all. So you can imagine when you're trying to fast and you get that shivering, this basically tells you that all the blood vessels that are headed towards the fat cells are dilating so that they can bring in this energy that's coming from the fat cells. So they are dilating, but blood vessels towards your nose, towards your all other organs are actually constricting because they don't need to go to take this energy anywhere else apart from getting it from the fat cells, the main organs, the brain, the liver, the kidneys. So of course you start feeling that coldness and shivering because that's a normal physiology. So never give up when you're fasting. Don't give up. The rewards that come after fasting are so tremendous. You enjoy it. Sleep improves. Your skin improves. Your breathing improves. You start feeling very light. Your memory improves. Your mental clarity is super high. As people are yawning, you're always wondering what is happening. And then they tell you this is contagious. That is their own business. You're busy making your work happen. As they keep on complaining how food is late, because remember, number one, the symptom of insulin resistance is when you sit in that hotel and start getting angry just because food has been delayed. Emotions are so high because you cannot handle your emotions. Hunger takes over. Samuti Bantu, Zakir, Nicholas, is there something like 1 meal a day? Yes, 1 meal a day basically means a 24-hour fast every day. That's the way to go. That's the way of life. 1 meal a day, possibly at sunset. 1 meal a day is the best way to live, bro. Just eat your meal. By the way, there's a new way to fast that you can eat within 12 within a 12-hour window gap. You can eat within that 12-hour gap, and then you fast for the next 36 hours. That will still help you achieve your health goals. Or alternate fasting, so that you eat today, tomorrow you're fasting, and you eat the following day. That's a new way to fast, a very awesome way, and the results are just tremendous. So you can try that. I get headaches when I break my fast. You're breaking it the wrong way. And you see, if you've been eating so much bad foods, you have nutrient deficiencies, mineral deficiencies like zinc, potassium, magnesium, sodium. You are deficient in those minerals. So when you start fasting, it exposes that. So the only thing you need to do for you to prevent these headaches, don't overeat, don't be super anxious. Take a walk before you eat, and then drink water that has a pinch of salt so that you can rehydrate. Then after that, go slow on it. Take carrot juice, take tamarind juice, take avocado juice, take cabbage juice, and then an hour later, you can now enjoy your meal, a fatty meal. But then do not consume any carbohydrates, including complex carbohydrate, until the next OMAD. So let's say you've been fasting for 48 hours and you're breaking it now. Just take your cabbage juice, take an hour, eat your eggs or your meat or your fish, enjoy it with vegetables and saturated fats. And then now you can stay until tomorrow, the same hour that you're breaking that fast. Then you can now enjoy your complex carbohydrate plus your protein. So there's Dirty and Clean Keto. Dirty Keto has those complex carbohydrates. For those of you who have already achieved health goals and they are not trying to reverse any condition, that is what happens. You can enjoy your complex carbohydrate. For those of you who are aiming at reversing a chronic condition before leading a healthy life, carbohydrates are a no-go zone. Go on a strict clean keto. For example, a menu for 1 meal a day. Basically, a piece of sweet potato, very fatty meats or fish, or the liver, or 8 eggs, plus vegetables. All of them have been cooked in ghee, tallow, butter, or coconut oil. Is purple cabbage good too? Yes, it is good. So now, as we proceed, let's go and tackle the diabetic food. Remember, if you're on this live, this is what you should remember. These are the complications of diabetes, the possible complications of diabetes. Number one is stroke. Number two is dental disease. Number three is eye problems and loss of sight. Number four is heart disease. Number five is kidney failure. On the kidney failure, gout, hypertension, anemia, vitamin D deficiency. Another one is sexual problems, infertility, erectile dysfunction, premature ejaculation, and all these problems. Then memory loss, which is basically type 3 diabetes, dementia, and Alzheimer's. Then we have neuropathy, the tingling, the burning feet, and then now we have the amputation. So those are just and even low immunity actually. So those are the complications that are supposed to happen, that will happen actually when you have diabetes. So for you to stay sane from those complications, stay away from sugar. Is that simple? Now again, before I forget, there is this drug called metformin, a very standard therapy for people who have pre-diabetes, who have diabetes, and people who are actually having, I think, fibroids. Women who have fibroids and PCOS sometimes are prescribed metformin. This drug will actually cause a deficiency in vitamin B6 and B12. It blocks the absorption of vitamin B6 from the stomach. Hello? One of the side effects of metformin is vitamin B6 deficiency or B12 also deficiency. Now, diabetics suffer peripheral neuropathy because of deficiency of vitamin B6 and B12. And then you are having these tingling effects, and then you're given a drug that actually blocks absorption of this vitamin, these essential vitamins. So therefore, anemia is loading, therefore memory loss is loading, and therefore more peripheral neuropathy is loading. So if you're wise, drugs come with side effects, diets don't. Go the diet way. Go the diet way. If you're on this live, if you're a new one here, kindly subscribe and press that notification bell so that anytime we have these brilliant health ideas that we share every other time, you are among the first people to be notified. If you're a returning subscriber and a watcher, we celebrate you. We appreciate you for coming through, for supporting our channel. Thank you so much for being here and taking your time to learn about diabetes. This is a home of health, and we'll yeah, that's it. So be quick to like that video so that it can reach most people, so that we can enjoy, all of us can enjoy this health content that we keep on sharing. Sorry about that that hitch, but regardless, we proceed. So the diabetic foot. Now we have two complications of diabetes. One is the micro. When you hear the word micro, that is smaller blood vessels. So sugar occludes the smaller blood vessels that supply the eye, that is retinopathy. That supply the kidneys, that is the nephropathy. And that supply nerves, that is the peripheral neuropathy. Okay, so those are the three minor complications of diabetes, or the micro complications of diabetes. And then we have the macro, which involve the larger blood vessels, the stroke, the amputation, the kidney failure also is here, the brain damage. These are the ones that are the macrovascular, larger blood vessels. And on these larger blood vessels, you realize the diabetic foot being one of these complications of diabetes, both on macro and micro. I'll explain how. Before that, there is a story that trended on social media platforms about the famous actor from Nigeria called Mr. Ibu. All of you can relate to that story. Now, apparently, the family of this gentleman told everybody that they don't know what is happening and they don't know what is ailing this gentleman. But for somebody who has been on my channel for the longest period of time, we can easily detect a problem when we see one. We will identify a monster when we see one. That gentleman had a pot belly. He still has one. That gentleman was obese. That gentleman was headed for amputation. That gentleman, they did not disclose if he was diabetic. But of course, in this channel, we speak the truth. We can never miss on diabetes on that gentleman. So the family played cool about it, but we will actually raise it up. We'll actually bring it up. So one video trends, this gentleman is going for amputation and he's in a hospital setup. Another video later posts out that this gentleman is celebrating his birthday just before an amputation. And on his table, I notice soda and juices. I notice a cake, and this gentleman is being fed with a cake to celebrate his birthday. Cake and soda, and somebody is going for an amputation, and he's in a hospital setup, and nobody said anything about it. Guess what? We will not be surprised that that hospital was feeding him with pasteurized milk. That hospital was feeding him with sugar, tea that has sugar and milk, bread, specifically the brown bread and brown chapati, and all the carbohydrates that are available in hospitals, brown rice and whatever, and the fufu. Because I also saw, one of the attendants serving this gentleman with fufu and meat and some vegetables, and definitely they have been cooked with seed oils because they don't have this information. So if you're a Nigerian on my platforms, kindly make sure that these videos get to this gentleman. We know how tough it is, but just kindly just share this video so that it can get to this gentleman. That if he doesn't change his diet, there's nothing that will improve. That amputation will happen to the other leg. The gentleman will just head to the grave earlier because they don't have the information. The fault is not his. The fault is because the healthcare system are just out to extract as much money from us or from you as possible. So how can you feed a diabetic patient going for an amputation with sugar? So this means I have to talk about amputation. So we told you that sugar blocks or occludes the blood vessels that supply the extremities. Sugar also kills the nerves that supply the leg. That's why you start having that folding feet. So the diabetics have feet that their toes are folded. So sugar is hurting the nerves, and therefore these people will not feel anything in the extremities, in their legs. They don't feel any pain. Even if they're struck by something, they don't feel any pain. The only thing they feel is the numbness, the burning and cold feet, and the tingling effect that looks like piercings, but it's from inside, from hurting the nerves, not from external. So when they wear tight shoes and they don't do feet examination, they get fungal infection or they get a wound that is just coming out of nowhere, maybe hurting, maybe physical trauma. That wound, they will never feel the pain because it's numb. So by the time they're getting to hospital for diagnosis, for proper physical examination through a person who has an experience of this, it is too late. The wound is already deep and necrotic. So the only option has to be the leg has to be chopped off. Now, guess what? You now chop off that leg, and now you start cleaning that foot with honey, another sugar. This is criminal. This is criminal. It's criminal. And you've seen, even our celebrities, you've seen most of them lying to you about weight loss and weight loss procedures. And then they fail terribly. What they don't even know is they are going for that procedure, but deep within, the problem is still establishing itself. So you go get that tummy off, but you've not handled insulin resistance. It is coming to kill you. So diabetic foot happens as a result of one, poor circulation towards the feet because sugar occludes blood vessels that supply the foot. Therefore, there's no nutrient supply towards that leg. There is no white blood cells or the immune system supply towards that foot. So therefore, if you get a small wound, there will be no healing because one, the wound has high sugar, so bacteria are feeding on that wound. And two, there is no supply of immune cells to help you fight that infection. And then now you're hurting the nerves that are supplying the same food. So there's no nervous transmission towards that food. So you don't even feel the pain. Just imagine that combination. Very worst combination for these people. So they'll feel the cold feel, they feel the burning sensation, they get their toes turning into different, they get that charcoal arthropathy where the feet is just losing shape. And they don't even know it because they don't feel any pain. So by the time they're coming to hospital for diagnosis, barabara ni moja. Barabara ni moja tu. So that's how diabetic foot happens. And it is so scary. That foot is so difficult to manage because for you to bring down blood sugars, there must be a near miracle. Now, at this moment in time, they're getting high shots of insulin, but their body cells, their fat cells, their storage of glucose is full. So where is this insulin taking this glucose to? Ask yourself that question. Insulin is supposed to pump blood glucose into cells. But where is this glucose going to if their cells are already full? That's why we question insulin therapy. So you will continue adding a higher dose of insulin in the morning and in the evening, but nothing is happening because you are pumping glucose into cells that are already full. So the only option they have is to rupture. You know, if you have a suitcase and then you fill it with clothes, and then you're trying to zip it up, and then you realize I've left some few clothes, and you keep stacking the suitcase with clothes. There comes a time when that zipper rips off and your journey is actually cut short. So at least for a bag or a suitcase, you can purchase another one. Can you purchase body cells? You can. So the only option for diabetics is one, to lower the insulin as low as possible by dropping the external shot, because that increases your insulin. But the essence of treating is the, the basis of healing from diabetes is to lower your insulin levels and rise your glucagon level so that you can burn instead of storing glucose. But if that is the case, why are you having an external shot of insulin? How is that going to change your situation? Why are you having an external shot of insulin, yet the intention of treating diabetes is to lower insulin? Use that question to benefit those people who are on insulin therapy. Use it to benefit those who are on insulin therapy. And I think it's time for me to raise my case. Unless there's a question I'll address, we will call it a night. So let me go back to the questions. Is purple cabbage good? Yes, it's good. I should be awarded a doctor's degree after every Dr. Lewis live. You are a doctor, and the good thing about health is your body talks to you. The body does not talk to your doctor. Your body talks to you, so you understand your body better than somebody who has studied anatomy and physiology. Don't overtrust the healthcare system, because most of these institutions don't care about you. If at all your diabetic client is still inside the wards and is still being served tea that has milk and bread, brown bread, still being given rice and beans, still being given juices and chapati, brown chapati, still being given Lucozade and Ribena, and you still take fruits to them, you're killing your patients earlier. Fruits are sugar, the body does not know the difference. So how do you reverse diabetes? Number one, lower your insulin levels to the lowest level possible. And how do you do that? Zero carbohydrate diet and fasting. Whether intermittent fasting or prolonged periodic fasting, you will change your situation. Number two, exercise. Go to the gym at least 3 times a week, or even do a walk. If you're obese, don't go to the gym. If you're obese, start by eating healthy keto and fasting so that you lose your weight to a certain level before you go into a gym and lift heavy. Because your upper body is already heavy and you'll end up exerting a lot of pressure on your joints, and that will cause you arthritis. You will not like the experience, therefore, you'll never go back to the gym. So don't go to the gym if you are overweight, extremely overweight, or obese. Lose that weight to a BMI of about 27, and then I'll go to the gym and tone that body. You can lose weight by fixing the kitchen. 80% of weight loss, 80% of chronic disease reversal is in your kitchen. Zero carbohydrate. We don't need carbohydrate to survive. Carbohydrates are not energy giving foods. Energy is coming from fat cells and not from what you've just eaten. So drop them. Eat healthy keto, fast, go to the gym at least 3 times a day, and rest after that. And go to the gym with an empty stomach. Don't take energy drinks or protein shakes in the gym. Just rehydrate with salt and water. Start enjoying life in a natural way. Sleep at least 8 hours a night. Enjoy the sun to stabilize your hormones. Reduce the amount of stress in your life. Drop sugar in all forms, including fruits and honey. Drop all processed foods. Drop all wheat products and simple carbohydrates. Basically, just drop all carbohydrates in general if you want to recover as fast as you would have loved to. And then be patient with yourself. You got diabetes over possibly a decade or 2 decades of eating unhealthy foods. So you don't expect to snap to get a result. Be patient with yourself. Enjoy the process so that when you recover from that process, you can easily explain it and spread the gospel to other people. That is the only way to go. Drugs for diabetes do not focus on treating diabetes. They focus on treating the symptoms of diabetes, which is hyperglycemia. Diabetes is not hyperglycemia. Hyperglycemia is high blood glucose. That is a symptom of diabetes or of chronic carbohydrate intake. And since diabetes is a chronic carbohydrate intake disease, why don't you drop the course? The symptoms will disappear. If you go to hospital and you have malaria, you don't treat the headache. You get an antimalarial to clear the plasmodium, and the headache and the fever disappear. Why is it the opposite when you're trying to treat chronic conditions like diabetes? Why do we treat the headache in diabetes and not the carbohydrate intake? So stop being a carbohydrate dependent person. Shift yourself to a fat adapted person. That is the best state to be in. When your ketone bodies are being produced, you're healing from inflammation, you're healing from brain damage, you're healing your nerves, you're clearing your system and detoxifying your liver, you are healing from the fatty liver. And the fatty liver is actually number one or cause of insulin resistance. And for those of you who didn't know, a fatty liver is not caused by eating fatty meats. A fatty liver is caused by eating sugar, processed carbohydrates, and sugar in all forms, including your favorite culprit, the fruits. So drop the fruits except avocado. Good, unless there's another question, we can proceed. Question. So insulin shots don't actually reduce sugar in the blood. No, they do. But the point is, where are they taking that sugar to? Because the reason why you're taking an insulin shot is because you want to pump these blood sugars into the cells so that they either be stored or be utilized by muscle cells or be stored temporarily as glycogen in the liver cells. So the essence of insulin is to open up the cells because it binds to the cell receptors and then opens up the fat cell, opens up the muscle cell, opens up the liver cell so that blood glucose flows into these cells for either in the fat cells to be stored as fat, in the liver cells to be stored temporarily as glycogen so that when you have low glucose, you can break it easily to get glucose, or opens up the muscle cell so that when you're working out, these cells can utilize that glucose in form of ATP. But if you're diabetic, your fat cells, your liver cells are already full of glucose. So where are you pumping this glucose from blood to? The only thing you need to do is to stop eating carbohydrates so that your body utilizes this blood glucose, and then now glucagon starts to go up, and we turn to fat cells and the liver cells to burn the storage form of glucose so that we clear the stores. Once we clear the stores, now we become sensitive to insulin. Insulin sensitivity is the opposite of insulin resistance. So it is the opposite of diabetes. So once these cells are empty, you become sensitive. So you'll need a very minimal amount of insulin to pump glucose from blood into the fat cells or into the cells. And that's what we want. Good question, Milka. Doc, is it okay for an old diabetic woman to take cabbage or carrot juice while fasting? Because it's not easy for her to go the whole day without food. Now, the reality is this. Fasting basically means 0 calories. You're not taking in any calories. So if you take cabbage juice or carrot juice, you're taking in calories, so you're not fasting. So the easiest thing to do to this is not take her to an OMAD. Simply take her to a TUMAD. One meal comes in at noon, and another meal comes in at 6 p.m. in the evening, or 6 to 8 p.m. in the evening. So you have a gap of 8 hours between meals, and then you have a gap of 16 hours of fasting. So once they adapt that, their insulin level starts to go down. Now they don't have cravings anymore. Now they don't have hunger anymore, so they can beat hunger because it's just a wave. And once they are 6-8 weeks into TUMAD, you can easily push an OMAD 1 day or 2 days in a week. Then they start to adapt. So their cells become sensitive again to insulin. That's what we need. Do you mean diabetes can be reversed? This is Oti Ojemo. Do you mean diabetes can be reversed even if the patient is in insulin injections? That is a no. But unless you start lowering the insulin injection, lowering the dose, because you have to talk to your doctor. So this is what you do, Oti. You introduce dietary modifications, a zero-carb diet, because the only reason why people need insulin is because they are of carbohydrates intake. If you don't eat carbohydrates, you will not need insulin. You will not. So if you go on a carbohydrate-free diet, your blood sugars will start leveling up. Therefore, the need of insulin will reduce. So that moment in time, you're monitoring your levels of glucose. For about 6 to 8 weeks, now you go to your doctor and tell your doctor, my blood sugars are okay. So we now have to wean off this insulin therapy. And then after that, as you reduce the insulin therapy and you wean it off, you just keep on with the dietary modifications. Your blood sugar is already stable. So that's what you're supposed to do. Exactly. Doc, what is the cause of pains in the joints and legs at the back and it's very persistent? That is a very general symptom. That can be arthritis, that can be physical injury. That's an open symptom. We cannot discuss about that. That can also be a symptom of diabetes. Remember, we just said the pain starts but it disappears once your nerve starts to die. And then you get a wound, and that gets to a diabetic wound. So the only thing you need to do now is to go on a zero carb diet, sir, and then start fasting. Fasting will heal inflammation, and the pains will disappear. And if you also have higher weight, drop that weight through the same mechanism. Because joint pains, back pains, all these come as a result of very heavy weight. Okay, no drug can change that for you. Good. So I think we can call it a night. We appreciate you so much for coming through. Thank you so much. Now, for those of you who would like to support the channel, and if you want to enjoy such content and you love it, kindly consider subscribing, and you can even join our membership groups. There are different membership groups. You can just press the join button and enjoy exclusive content on those membership groups. Also, you can support us through our M-Pesa contacts and M-Pesa till number. Before I even end it up, let me just, there was somebody who sent us a super chat yesterday and I did not shout them out. So I have to do that now. This is a person called, who was that? Let me just see. Stephen Mudomi, we appreciate your support. That was highly appreciated, and it doesn't go without noticing. So thank you for the super chat. You can also support us through super chats on these videos. We will appreciate that. You can also join our Telegram channel, Health and Wellness Sport. It is a mini library. You'll enjoy exclusive content on that platform. If you're a new person here, thank you so much for passing by. Consider subscribing because this is a home of healthcare. And if you're a returning subscriber, we cannot do without you. You're the ones who make us do these videos every other time. So again, we'll see you on Friday for a live at 8:30. So tomorrow we're not having any live because of, as we said earlier, our lives will be on Monday, Wednesday, and Fridays. So tomorrow we're not having any live. So thank you so much for being part of us tonight, and we hope that you learned something. If you didn't, you can go back to the video. It's so detailed, so much information. We'll still shoot other videos to educate you even more. So thank you so much for being part of us, and may God bless you this night as you recover from your root of the slavery of drugs and these chronic conditions. Stay blessed.